important to use randomness to split them up into either the treatment or the control? Why don't we just let them decide? And to talk about this a little bit more, we're going to go ahead and look at an example. So cognitive behavioral therapy has been run out as a treatment for anorexia in probably the last 15-20 years or so. So let's say that we wanted to test, is CBT or cognitive behavioral therapy actually effective, or is it just more of a fad? To do this, let's assume that we had the best case scenario, and that is we were able to randomly select a group of women who all suffer from anorexia. Now that we've got our group of women, once again, ideally randomly selected, what we want to do is split them up into either our treatment group. We're trying to see if CBT is effective. That is cognitive behavioral therapy. We start to see some problems emerge, right? The ones who are ready to actually seek treatment would probably be more likely to go ahead and look at CBT. Those women who are more resistant to treatment would probably go more with nothing. So right away, we'd have biases in the way the samples were chosen. The treatment group would be made up of people more willing to seek therapy and probably more willing to gain weight than, where the control group would be those more resistant and therefore less likely to gain weight. In this way, even though our sample was randomly selected, by not splitting them up into groups randomly, that is not doing that secondary process, we would bias our results. For that reason, once again, random selection here is really important. Now, there are other means we can take to make sure that in reality the results we get of which treatment they are receiving. Now, this is a really super important concept. That is, if I have two people show up for my study, and let's say I'm trying to test whether antidepressants are effective or not. Well, if one person is in the treatment group and one is in the control, I'm going to hand both of them probably a pill. So I'll be giving the guy on the left there in the treatment group the antidepressant and the guy in the control group the placebo. Well, if they know which one they're receiving, if I tell the treatment guy, here's your antidepressant, and the control guy, here's your placebo, probably not going to have the effects I want. That's why it's important, once again, to run my study blind, if possible. Now, ideally, it's not just a blind study, but what we call a double blind. In a double blind study, both the participants of who is receiving what. Now, I want to be really clear here that this doesn't mean that no one knows. It just means that the participants themselves and the people who are directly A, interacting with the participants, and B, analyzing the data. If I know one guy is taking an antidepressant and he comes in and complains of, let's say, fatigue, he comes in and he complains of, let's say, a headache, I might be thinking to myself, well, he's on antidepressants. That actually might be a side effect of it. So this guy in the treatment group might have a headache or fatigue attributed to actually side effects. Whereas if the other guy who is in the control group comes in and complains of the same symptoms, I might be like, well, he's fatigued, he's depressed, he's got a headache. That means I can't do this. I can't bias my observations based on the knowledge I already have. For this reason, a double-blind study is actually even better.